Hi, my name is Shivani Sharma, and I am a 2021 PharmD candidate, and today I will be talking about thiazide and thiazide-like diuretics. I will be discussing patient counseling, the drugs that fall under this classification, the mechanism of action, dosing and administration, and some warnings and side effects. So let's start with patient counseling. Thiazides are mainly used for high blood pressure, but can also be used for edema. They can be taken with or without food. You want to take this medication earlier in the day since it may cause frequent urination. It comes in a tab dosage form, but for patients with difficulty swallowing, the tablet can be crushed and mixed with a fluid. If you miss a dose of this medicine, take it as soon as possible. However, if it is almost time for your next dose, then skip the missed dose. Do not double the doses. Store this medicine in a closed container at room temperature away from heat, moisture, and direct light. Some common side effects include dizziness, fatigue, headache, high blood sugar, and increased urination. Stop taking the medication and call your doctor if you are pregnant or may become pregnant, unable to urinate, very tired, dizzy, or confused, or have swelling of your tongue, face, or throat. So what are thiazide diuretics? There are thiazide diuretics, which are the true thiazide class, which include hydrochlorothiazide, brand name microzide, and chlorothiazide, brand name Diryl. And there are thiazide-like diuretics, which include chlorthalidone, indapamide, brand name Lozol, and metalazone, brand name Zeroxolin. What distinguishes these two categories from each other is the presence of the benzothiadiazine ring that is in the true thiazide class and not in the thiazide-like, giving the thiazide-like class a longer half-life. Both classes are indicated for high blood pressure and edema. So how do thiazides work? Thiazides work on the proximal part of the distal convoluted tubule in the nephron. They inhibit the sodium chloride cotransporter across the epithelium. This causes an increase in sodium chloride concentrations, which indirectly increases potassium excretion, which increases urine volume, which decreases plasma volume, which decreases cardiac output, which leads to the blood pressure reduction. This pathway causes a short-term effect. Plasma volume returns to almost normal after 2 to 4 weeks of therapy. However, these medications also cause vasodilation, which has a more long-term effect by causing a decrease in peripheral vascular resistance, which helps in keeping the blood pressure lower. Dosing and administration. For hydrochlorothiazide, you want to initially start at 12.5 to 25 milligrams once daily. Dose can be increased to 50 milligrams a day if necessary. Starting doses for chlorothiazide is 500 to 1,000 milligrams a day given in 1 to 2 divided doses. Max daily dose is 2,000 milligrams. Do not use hydrochlorothiazide and chlorothiazide if creatinine clearance is less than 30. For chlorthalidone, the initial starting dose is 25 milligrams once daily and can go up to 100 milligrams once daily, and no adjustments are necessary. Indapamide starting dose is 2.5 milligrams once daily, and max daily dose is 20 milligrams once daily. However, doses greater than 5 milligrams once daily have not shown any additional benefits and have an increased risk of hyperkalemia. Also, do not use indapamide if creatinine clearance is less than 30. Starting dose for metalazone is 2.5 milligrams once daily with a max of 5 milligrams once daily, and no adjustments are required. Some adverse effects of these medications include hyponatremia, hypocholeremia, hypokalemia, hypomagnesemia, hyperuricemia, hypercalcemia, increased glucose, increased lipids, and sexual dysfunction. Because of these adverse effects, we want to caution in patients that have diabetes, gout or kidney stones, dyslipidemia, hyponatremia, and these medications are pregnancy category B. Some of the drug-drug interactions we see with these medications are with lithium, digoxin, and allopurinol. There is a risk of lithium toxicity due to decreased sodium. There is a risk of digoxin toxicity due to decreased potassium and magnesium, and there is a risk of allopurinol hypersensitivity. Thiazide and thiazide-like diuretics are contraindicated in patients with anuria or if patients have a sulfa allergy. When taking thiazides and thiazide-like diuretics, there are parameters we need to monitor. These include electrolytes such as sodium, potassium, magnesium, chloride, and calcium. We also want to monitor blood pressure to see if the medication is working. And we also want to check blood glucose and renal function. These are my references, and thank you for listening to my presentation.